Welcome to week 36 of the Mama Stay Fit Pregnancy Week by Week update. In this video, we're going to discuss what's going on with your baby, what might be going on with you, and I'm going to share how I am feeling in my 36 week of pregnancy as well, because I am currently pregnant with baby number 4. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula and currently pregnant with baby number 4. So I'm going to be sharing my personal experience navigating the very end of my pregnancy. I'm almost at the point where it's any moment now a baby could be born.
And I'm Roxanne. I'm a labor and delivery nurse and student midwife and mom of 3. And I'm going to be sharing what's happening with baby and you.
Before we dive into what to expect during the 36th week of your pregnancy, if you're looking for more support at the very end, we do have third trimester specific programs to help educate you on childbirth and what to expect when labor begins, in addition to prenatal fitness programs and birth preparation programs that target the end of your pregnancy. You can check out our app-based program, which is our strength program, where you can just grab the 1 month that you need for this very end. The first program is going to be a self-paced program in the Team Builder app, and this is going to be a list of exercises with short demo videos, and the good news is you can just grab the 1 month that you need because you can cancel anytime. If you're looking more for follow-along workouts, we do have an on-demand program that's specific to the third trimester that you can do as well. If you already have a workout program or you're looking specifically for birth preparation, we do have a birth prep on-demand program that you can grab as well, and we'll link them all down in the notes below. So Roxanne, what can we expect for baby in week 36 of pregnancy? They're pretty much fully cooked at this point.
Pretty much fully cooked. So at 36 weeks, we consider babies to be late preterm. So they're still preterm, but they're on the later side. So a lot more things are more developed and they're more likely to be able to transition to life outside of the womb with just a little bit more monitoring for these babies. So babies can be born at 36 weeks. But they may recommend staying in the hospital for a few days more just to make sure the baby is gaining weight, maintaining their blood sugars and their temperatures, because they may just need a little bit more help or more monitoring at 36 weeks. But babies, 36 weeks, again, late preterm, pretty much almost there. They're the size of a bag of Bugles. I personally love Bugles, putting them on your fingers and eating one at a time. But a bag of Bugles or romaine lettuce head, if no one eats Bugles. I don't know if people eat Bugles anymore. Some babies in the week 36 are descending and engaging into the pelvis at this time. Not all babies, but they might start that descent and engagement into the pelvis. So you might start feeling more pelvic pressure and you might start developing that pregnancy waddle because baby is now further down into that pelvis at week 36. Are you feeling that, Gina?
I do. There's lots of pelvic pressure. There's a lot going on down there, but engagement does not equal labor.
No, it doesn't.
The baby is super engaged right now. I will probably still be pregnant to 41 weeks.
It'll be a very comfortable 4 weeks for Gina. With baby's development, their lungs are either almost developed or pretty much fully developed. Every baby is kind of different on whether or not at 36 weeks it is fully developed, but they will be able to transition to life outside of the womb pretty quickly around 36, 37 weeks because those lungs, again, are pretty much able to do oxygen exchange, expand once they are born. When babies are born before 36 weeks, this is the one thing that we're concerned about is because their lungs are not fully developed, that they might need more help breathing. Their blood circulation is now also fully up and running. So before, again, it might take longer to transition to this extrauterine blood circulation because in the womb, they're bypassing certain things that they don't need to send blood to, such as the lungs and certain other things within their body. So when they're born, we want their blood circulation to be able to transition to that life outside of the womb, to be able to send blood throughout their body efficiently. And before that blood circulation has fully developed, it might make it a little bit harder or might make it a little bit longer of a transition for those babies. The last thing is that lanugo, so that fine, white, thin hair that surrounded their body, as well as that vernix, that cheesy kind of consistency that was keeping their skin moisturized, that is all starting to shed into the amniotic fluid. And babies are actually, swallowing this vernix and lanugo, and that's actually part of properties that are making up the meconium that's building up in their bowels. So the vernix and lanugo is falling off, but it's being put to good use. Baby's bones are also starting to harden, but baby's bones won't like fully harden until like throughout childhood. It's a lot of cartilage that makes up a lot of their bones because one, they have to like maneuver through a pelvis, so we don't want super hard bones. But a lot of their bones also don't fully fuse until they're older in life. So they're actually born with more bones than we have. There's like 276 bones in babies, and we only have 206 bones within our bodies because they have bones that start to fuse, one of them being like the skull bone. So it's kind of cool. That's really it with baby, though, at 36 weeks. Not a ton happening because obviously things have already fully developed, minus the two lungs and blood circulation are the two major things that's happened. But for you, obviously, pregnancy symptoms continue. It doesn't end until the baby's born, and then sometimes it still continues. You might start to experience that waddle now that baby is descending and engaging into the pelvis. This is called lightening because as baby descends into the pelvis, this actually allows your diaphragm to like have a little bit more range of motion so you can actually breathe a little bit more at the end of pregnancy. But as baby descends into the pelvis, you might start to develop more pelvic aches or pelvic pains than you were experiencing before, just from the pressure of baby's head in the pelvis. Another thing that starts to increase at the end of our pregnancy, so it already kind of increased throughout pregnancy, but it increased the most at the end of pregnancy, is our vaginal discharge. So you might start noticing a little bit more watery discharge at the end of pregnancy. And this can be confusing because you have this increased discharge, but also your amniotic fluid is really watery. So sometimes people can get confused whether or not their water actually broke, or is it just an increase in vaginal discharge? And then as well, you might start to lose what's called your mucus plug. So all of a sudden you have this watery discharge, and now it's like this really mucusy kind of like looks literally just like a booger, a really large booger is the best way to describe it. All of a sudden in your underwear, and you're like, what the heck is that? And that is your mucus plug. You have two people that when they lose their mucus plug, one, they immediately come to labor and delivery because they're like, I'm going to go into labor because I lost my mucus plug. Or you have the person who actually does go into labor and doesn't come into labor and delivery immediately because they're like, oh, whatever, like I'll go in when I'm ready. So with the mucus plug, it can be an early sign of labor that your cervix is starting to dilate early on in that early labor portion, like you're having the contractions, and these are good signs that your contractions are doing something and labor is progressing. But you also have the other people who just slowly dilate throughout their pregnancies and lose their mucus plug earlier on, but it's not actually correlated to labor at all. If you lose your mucus plug, it does not mean that labor is imminent, but if you are having those contractions, losing the mucus plug could be a really good sign that you are in labor, and just kind of like continue riding that ride until the labor contractions increase to the intensity where you're needing a lot of support. In between the contractions, you're not really like present in the room anymore. You're kind of in your own world. Those would all be signs that maybe you are in more active labor, and heading to the hospital would be a good idea. If you're confused whether or not it's vaginal discharge or it is your amniotic fluid, there are two things you can do. One, I usually recommend putting a pad on. If you put a pad on and you soak that pad within like a couple minutes, if not like even 15 to 20 minutes, that pad is like pretty soaked with some sort of fluid. Likely you're either peeing yourself, which unlikely, or it is your amniotic fluid. You should not have so much vaginal discharge that you are filling a menstrual pad. That is too much vaginal discharge. It is likely your amniotic fluid. The other thing that you can do is some people will smell it. And amniotic fluid has a very distinct, like musty type of odor. It's like a sweet, musty odor. I always describe it. It's like sweet and salty kind of, but amniotic fluid. Whereas vaginal discharge it smells like a vagina. So those are other things that some people will smell it to be like, okay, this doesn't smell like my normal vaginal discharge. This is likely a reason to go in. I will say, if you recently had sex, usually within the past 24 hours with a male partner and you did not use condoms, that sperm has to come out at some point. It doesn't always come out immediately because our pelvic floor muscles can sometimes hold it in and like will randomly at a different time throughout the day let it go. And many people will come in to the hospital thinking their water broke because they had a gush of some sort of fluid. And we will put it on the microscope, we'll collect it and put it on the microscope, and we'll just see little sperm swimming around. And we're like, good on you for coming in though. Good on you for coming in, but not your water. That was just the sperm. So just to sum up, vaginal discharge.
A lot of it.
Vaginal discharge increases at the end of pregnancy more so than it has throughout pregnancy, and that is normal, but it can be confusing because there are a lot of other things happening at the end. One, it could be that your amniotic fluid, so your water has broken and it's not that increase in vaginal discharge. So putting a pad on can be really helpful for that, as well as you might start to lose your mucus plug. So that is a more mucousy type of discharge, so way different than your normal vaginal discharge. And that can sometimes be alarming for some people because it can be like red streaked or bloody, which can be alarming if you all of a sudden look down and you have not bled for 9 months and then you see mucousy blood. You're like, what the hell is that? So that can be alarming, but also completely normal. It can be a sign that labor is imminent or starting, or you could already be in labor and then you start to notice it. And also, if you have intercourse at the end of your pregnancy and you don't use a condom, it could be sperm that's coming out and not an increase in vaginal discharge. So really just putting a pad on if at any point you notice an increase in some sort of fluid, and then that can help determine whether or not it was your amniotic fluid or potentially just something normal. That's really all, other than a lot of fluids.
It's a lot.
That's really all that's happening in week 36. But Gina, how are you doing?
I'm doing good. This is the final week before any moment now, the baby could be born. So it's kind of like this weird limbo where I don't anticipate that I would go into preterm labor or that I will have a baby before 41 weeks. But it's still like this weird window where I'm like, if I go into labor this week, my birth plans are very different than if I go into labor like 3 days from now. And so there's a little bit of anxiety during like the 36th week because of how close I am to like the all clear to give birth at home. But again, I will probably still be pregnant for week 37 and week 38 and week 39.
We're going to have a 42-week
We'll have
pregnancy
a 42-week pregnancy update. But again, there's still that little bit of anxiety. During this week, we've kind of got the final preparation kind of done. I like to have all that stuff done before week 37 just so that I can just relax until the baby is born, or as best I can. I don't relax very well.
Gina does that.
So all of my postpartum prep stuff is here and like is all set up. Everything that we need for the baby has arrived. Everything that I am planning to use to support breastfeeding or like for my bedside table is pretty much all set up and ready to go. So we're just waiting on a baby now at this point. I've had 2 prenatal appointments in this past week. One was with my hospital-based midwifery team. That was the last appointment that I had with them until I'm 41 weeks and need an NST. But hopefully, maybe I won't need it. You never know. With that, I found out that my iron levels have doubled since when I got them tested at 28 weeks and I was borderline anemic. It's still low, so I'm still going to take my iron, but it's much higher now, which is probably why I'm significantly less anxious and also sleeping a little bit better.
And what did you take?
And I was taking needed iron. So what's really nice is on their website, they give you how much to take based on your ferritin levels. And they also give you like how much to take based on your trimester if you haven't been tested for your ferritin levels. And because mine were so low, I was at max dosage. So I was taking 4 a day. And I would drink it with orange juice or something high in vitamin C. And I made sure I didn't take them around the same time I was eating anything that had like calcium in it. So I wasn't drinking it with milk or cheese or all the things that I liked to eat throughout the day. And so I think that really helped with like the absorption as well. So my levels were 6.4 and now they're 13.4, which is still low, but better.
Do you still have to take 4?
No, now it's 3.
Ooh,
Yeah,
one less.
I've upgraded or downgraded, I guess. So Needed is my preferred brand. It was obviously worked very well for me. I highly recommend them. And yeah, so I'm going to continue to take them until birth because you lose blood at birth. And I would like to have high iron levels or as high as I can going into it. And I will probably continue to take it postpartum as well. And I'm going to get my ferritin levels checked again after birth also, just to see.
Just in case.
If I'm back down to where I was. So that was pretty exciting. I had an appointment with my home birth midwife as well, and she was able to check on baby's position and see where she was, and she's very low. She's very engaged, deep in my pelvis. This is the first time I've really felt like a lot of pelvic pressure to where like I am waddling because it like kind of hurts to move because she's just so deep in there. And just like lots of like lower abdominal discomfort and like pain. Roxanne asked me if it was contractions and I was like, nope, this is just all the time. This is just who I am now. So I've been finding like inversions have been really helpful to kind of relieve some of the pressure. Doing pelvic tilts, so just anything where my belly's towards the floor and like kind of like just moving my hips around seems to be bringing a lot of comfort for me. So I did a bunch of that right before this, and I feel much better than I did earlier today.
Baths can also help because
Baths.
it kind of helps lift the baby, decreases gravity.
So I've been doing a lot of pool
really nice.
time. A lot of pool time. And then I've also been using a lot of magnesium lotion on my legs because my legs have just been really sore. I've been getting fatigued a lot more easily now. So my workout volume has definitely decreased. My intensity levels are on the easier side of things. And lots of magnesium lotion. I've been using 8 Sheep Organics magnesium lotion. I haven't had any Charlie horses yet this pregnancy.
I got them so bad.
I am slathering myself in the lotion, so maybe that's what's helping. And I also have like a giant water bottle next to my bed at night because I still wake up about once a night. But my sleep has significantly improved this past week with no new things being done other than
the magnesium lotion.
The
being
magnesium
lathered.
lotion being swimming in it.
So as magnesium was
But
the
I
key.
also have like, because everything's kind of done, I think that has kind of like decreased my like stress levels where I'm like, oh, I can just chill. And I think that's been helping with the sleep as well. Because like our major projects are pretty much done and all the stuff we need for baby is done. And then once I hit 37 weeks, it'll be like, okay, any moment now. And the anxiety will increase because it's somebody asked me like, what do you do in the last few weeks when you're waiting for baby? Like, how do you mentally deal with that? I'm like, not well at all, actually. So enjoying this last week before we are 37 weeks and
The
any moment
countdown
now.
begins.
Any moment now. So let us know your guesses down in the comments below. When does Gina go into labor? My history, first was a girl, 41 and 3. Second was a boy, 40 and 1. It really threw me off there. I thought I was going to be a normal or early person. Third was 41 and 3, also another girl. Star chart says due date, baby. We will see. Let us know in the comments what your guesses are. If you guess correctly, I'll heart your message. You will get attention from me as a reward. But thank you so much for listening to what to expect during week 36 of your pregnancy. You learned what was going on with your baby, what might be going on with you, some things to look for. Know that the mucus plugs does regenerate. So just because you see it doesn't mean anything's happening, but you never know. It's always worth exploring. And then thank you for listening to what's going on with me because, again, this is my pregnancy that I am sharing about. But if you are pregnant, be sure to comment below to let us know how you are feeling. I would love to connect with you because it's been really cool about social media and doing these videos is being able to connect with so many of you that are on the same journey as I. If you want more support throughout your pregnancy, be sure to check out our online prenatal fitness programs, and you can still join our programs even this late in your pregnancy. You can just grab 1 month, you can just grab the 3rd trimester, or just the birth prep programs if you're just wanting something to kind of help keep you moving during these last few weeks during your pregnancy.
And if you're still looking for some education courses, we have a condensed childbirth education course that goes over pushing mechanics and ways to decrease your risk of tearing, as well as labor positions and labor comfort techniques. So it's a more easily digestible course for this later term in pregnancy if you have not done a childbirth education course. But also at 36 weeks is a great time to prepare for the postpartum. We spend all of pregnancy preparing for birth, and most of us spend 0 time preparing for postpartum, to include us for our first postpartums. So this is a great time to start preparing for postpartum, and we have a newborn and postpartum preparation course to prepare for what to expect for baby in that first month postpartum, as well as how you can prepare and support yourself in that postpartum period, because honestly, we think postpartum is so much harder. And as a thank you for listening to this entire episode of Gina's pregnancy and me babbling about what's going on with you and your baby, you can use code YouTube10 to get 10% off any of our courses to include fitness programs, childbirth education, and postpartum prep.